The obesity or being overweight is a real problem. It's a problem world over. It's increasingly becoming a problem in our country. It is in fact a global epidemic now. And the problem with obesity is that obesity is dangerous. Obesity causes diabetes, it causes high cholesterol, high blood pressure, and a combination of these three is crucial in terms of causing heart attacks and death from heart attacks. It also increases the risk of various cancers. It causes a condition called obstructive sleep apnea, which is difficulty with breathing and dangers associated with stopping breathing. Arthritis or pain in the joints, and that's easily understandable. If your joints have to carry more weight, they are going to wear out quickly. It causes infertility, particularly in ladies, and it can have enormous mental health problems such as depression. So obesity is not a cosmetic problem. It is not about looking good. It is about health and longevity. The link between diabetes and obesity is very important. Obesity directly causes diabetes because if fat accumulates in the body, insulin, which is the main hormone that regulates blood sugar levels in our body, cannot work properly. There comes about what is called insulin resistance. And in fact, a new term has now been coined, that is diabesity, to appreciate that link that is there between diabetes and obesity. And this is particularly important for us because our country is due to become the diabetes capital of the world in the next 10 years. And there is an enormous financial burden that is associated with diabetes in terms of not only medication for diabetes itself, but care of the complications that come about as a result of diabetes. So let's consider a patient whom I recently had. So this is a 47-year-old man who was a very successful executive with a multinational company. He weighed 120 kilograms, was of average height, 5 foot 10 inches. Had developed diabetes about a year prior to him seeing me. And when he came to see me, he was taking 6 different tablets for his diabetes and had been recently started on insulin by his doctor for control of his blood sugar levels. Intelligent man, his doctor had emphasized to him that weight loss is very important. So he started on a diet, went to a gym, and lost about 10 kilograms over a period of 3 months. And that's in fact very good. So he's lost about 7 to 8% of his starting body weight over that 3-month period. The difficulty, of course, is that diets are not sustainable. You cannot continue on a low-calorie diet endlessly, even if you understand the problems that go with not being on it. So he regains the weight and now is 124 kilograms and displays what we call a typical yo-yo pattern. That every time the yo-yo goes lower, it stops at a lower point on the next bounce. And now he's at the stage where he's needing more medicines for his diabetes because with his weight going up, his diabetes is getting worse. So what's the option for this man? What can he do? And that's where the branch or the discipline in medicine of bariatrics comes in. Bariatrics is the branch of medicine that deals with the management of weight and weight-related problems. And given all the various disciplines that we have in medicine, such as cardiology, for instance, endocrinology, so on and so forth, bariatrics is a relatively young discipline. The term was coined only around 45 years ago. And like very many other instances in medicine, it's derived from Greek roots. So like you have pediatrics, which is care of children, bariatrics is care of the overweight. And of course the very exciting thing, and this is something that we would not have thought about, is that an operation on the stomach is the most effective cure for diabetes. And this is a landmark paper in one of the medical journals that was published almost over 20 years ago, when this link was first recognized. And for that reason, bariatric surgery, that surgery for weight, is often referred to as metabolic surgery. Because metabolism is the workings of the body. And because surgery cures and helps with diabetes, it is also known as, or probably better known as, metabolic surgery. And huge amount of interest being generated all over the world, and increasingly in our country as well, because we understand this better now, that by having an operation we can cure diabetes. And a country in which diabetes is exploding by leaps and bounds, that is of course critically important for us to pay attention to. So who is a candidate for surgery? If we are saying that there are many millions of people who are diabetic, there are so many people who are overweight and obese, we are certainly not saying that we should offer operations to all these people. That is not workable, that is not sensible. And that brings us to the question of what is obesity? How do we medically define obesity? This is something very simple which all of you can do, and that is to calculate your body mass index. So if you use your weight in kilograms and your height in meters, so remember the height needs to be expressed as 1.5 meters or 1.75 meters as opposed to feet and inches, which is what we are usually used to doing. So you divide the weight by the square of the height in meters, and you can do that using a simple calculator, and that will give you the BMI. A BMI of more than 23 is considered as overweight, and a BMI of more than 25 is considered as obesity. And surgery is recommended if the BMI is higher than 37.5 or more than 32.5 if that person has already developed diabetes or has developed another obesity-linked disease such as high blood pressure or high cholesterol. So if the dangers or the damage caused by obesity has already set in, then we lower the threshold of the BMI at which we would offer an operation to somebody. And the logic for that is simple, that why do you want to wait for the damage to progress once it has already shown signs of setting in? So just remember, those are the numbers I'd like you to remember for the rest of the talk. That BMI 25 means obesity, and start thinking of an operation if the BMI is more than 37.5 or if it is more than 32.5 if there is associated diabetes or another health related problem. What can surgery do? Let's go back to the gentleman whom I talked about. So just to briefly recapitulate, he was a 47-year-old man, weighed 120 kilograms, was on diabetes with several medication. Has a bariatric surgical operation. 1 year after the operation, he weighs 80 kilograms. His diabetes has been cured. He is not taking any medications at all, and his blood sugar is within normal limits. And this is one of the statements which we repeatedly hear from patients who have bariatric surgery, is that thank you, I've got my life back, because this is life transforming and life restoring work. It's incredible. Think of somebody who weighs 120, 150, even 200 kilograms, all the limitations that they have that go with it. And then they have an operation and their life is transformed and restored. So to summarize,